So in terms of the two types of replacements of a total shoulder arthroplasty or a total shoulder replacement is replacing the ball and socket and using, they term it an anatomic replacement. So it's typically a metallic ball on a polyethylene or plastic socket, and it maintains the normal spherical sort of ball and socket formation. A reverse shoulder replacement, which is the other type, typically it's a reversal of where the ball and socket are, and it's usually used for those that have massive rotator cuff tears in the setting of osteoarthritis. To kind of summarize the difference is you need a functional rotator cuff to have success following a regular shoulder replacement. If the rotator cuff is in some way torn or chronically injured to some degree, that usually entails having to consider a different type of replacement, which is the reverse shoulder replacement. Reverse shoulders are also an option for fracture patients with 3 or 4 part fractures of the upper part of the humerus. So those would be the two main indications for a reverse, would be a chronic or massive rotator cuff tear in the setting of arthritis, or a complex 3 or 4 part fracture of the proximal humerus.